Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. Building relationships with doctors and forming clinically integrated networks is a key strategy for hospitals, as how they're paid is increasingly tied to quality and outcomes. Today, I'm joined by Dr. Thomas Raskauskas, President and CEO of St. Vincent's Health Partners in Bridgeport, Connecticut, which recently formed a physician-hospital organization with more than 350 providers in the area. Tom, thanks for being with me today.
Well, thanks for inviting me.
Could you just start by taking me back a couple of years and telling me about the conversations you were having at your system that led up to you creating this physician-hospital organization?
About 3 or 4 years ago, the medical staff at St. Vincent's Medical Center and the hospital administration decided to get together to see what would the response be in terms of how the doctors and the hospital would respond to the Affordable Care Act and how there could be tighter alignment. They looked at all kinds of models and decided what they would go for as a physician-hospital organization. And so on May 18th of 2012, our organization became incorporated, and we're here today 2.5 years later.
Could you tell me about how you went about structuring this organization to make sure that it would be positioned for success?
The Affordable Care Act allowed for a new innovation department in Medicare. And Medicare started out with the Medicare Shared Savings Plan. So that drove a lot of organizations towards the accountable care organization structure. At the same time, commercial insurers were interested in contracting and developing clinically integrated networks. So we started with a blend of both the Medicare Shared Savings Plan model as well as the model that the insurers, the commercial insurers, were initiating through clinical integration.
What have been the challenges so far? What have been the obstacles that you've come across in setting this up?
Well, our organization's in Connecticut, and Connecticut over the last few years has been a little bit slow to start on the track towards reform in terms of adoption of electronic health records and electronic prescribing. With that being said, the last 12 months, there's truly been an unbelievable leap in terms of adoption of electronic health records, e-prescribing, and consolidation of health systems within the state. Still, at the same time, it's physician engagement. A lot of practices, even in large systems, are still solo or 2- or 3-person offices, and to try to get all of the physicians moving in the same direction is a real challenge.
How did you look to get past that, or what was your answer to that challenge?
Well, together with our Director of Professional Relations and our Chief Medical Officer, we went out to each of the provider offices and we're meeting them in their territory where they're more comfortable. So in terms of getting them engaged, it's building the trust. We meet them in the medical staff lounge every Tuesday and Thursday morning, and we meet them in their offices on a monthly basis. We try to present all of the information where healthcare reform is going in a clear, concise way that's digestible. Our role is to make the doctor's job a little bit easier, so all they have to worry about is practicing medicine, and we provide them the background materials to help with the reform take place.
So it's been a couple years now. What sort of results are you seeing? Are you starting to see this bear fruit?
We are. One of the requirements for our organization is primary care physicians have to become patient-centered medical homes. And as such, a large number of our doctors have already made that journey, and we've really seen them make the transformation, going from fee-for-service to value-based contracting and having extended office hours and following up more patients in terms of chronic disease management and preventive health maintenance. The other thing that we've really seen is with our commercial contract with Anthem Blue Cross Blue Shield, we've had a dramatic reduction in unnecessary ER utilization and really connecting with the office, the doctor's office, with the patients and bringing patients into the office for more appropriate care. Our goal is to provide appropriate care in the appropriate setting, whether that's the doctor's office, urgent care, or emergency room. And I think that's one of the biggest areas we've made inroads in.
What advice might you offer to other hospital CEOs who are just getting started along this journey?
Well, the first thing is to truly have a business plan and not to just say we're going to start it and reassign people duties and add on to their care. It has to be a good, I would say, 6 to 8 month planning phase. And then the implementation phase is a good 12 to 18 months. So you're really talking a 2-year journey down this process, and it can't happen tomorrow. There's no such thing as over-communication and over-engaging your doctor's offices. You have to bring everybody aboard, and you can't just go full steam ahead. So the two biggest things are planning and really engaging your physician community.
Tom, thanks so much for being with me today.
Okay, well, thanks for having me.
With H&HN, this has been Marty Stempniak.